Okay, perfect. Right, so hopefully you can all hear me. I can see the chat window in case you have any kind of questions as we go. So welcome to this webinar about budget impact analysis export in TreeAge Pro. If you have any questions as we're going along, please feel free to kind of send them to me in the chat, or you can email them to support@treeage.com after the meeting. So what we're going to look at in this particular webinar, there's kind of three elements that I want to go through. The first one is showing you how to set up your cost effectiveness model to be able to capture outputs that you need as a budget impact model inputs. Okay, so we're all most of us are familiar with creating cost effectiveness models in TreeAge, but how do we get those outputs that we need from there into a budget impact model? And then what I'll do is show you using the export tool that we've got, how to get those model outputs into Excel. And then lastly, what we'll do is have a look at an example budget impact analysis model that we've made in Excel, which uses those values that we've got. So basically, budget impact is going to examine the cost impact of switching to a new treatment at an aggregate population level. So you look at basically what happens to the changes in expenditure that you have as a budget holder over time, which is slightly different to just looking at a cost effectiveness analysis tool, an analysis model itself. So budget impact analysis tool is basically going to allow you to export cost data from a TreeAge Pro cost effectiveness model and incorporate that cost data into your budget impact analysis model. And this process, as it happens, creates an Excel workbook with exported data from your cost effectiveness model in TreeAge, and then you can build an appropriate budget impact calculations around that using the exported data. Okay, so that's kind of the steps that we're going to go through. So the first thing that I want to talk about is how to basically split some cost values that you have in your model and split those out. So we're going to, but some budget impact models may require overall costs in those models to be split into different categories. So we have a tool that we've created in TreeAge that's going to help you do that. This can be used for a number of things, not just budget impact analysis, but I'll kind of show you, I'll show you it in the context of budget impact analysis, but I'm sure you'll be able to see other uses for that. So I'm going to use models that are available in the software so that you can also replicate this yourself if you want to later. So in the example models, if we go into the healthcare section, you'll see that there's a number of models in here with kind of budget impact written in there. And the model we're going to start with is this budget impact Markov before split. So we're just going to open that. And it's currently a cost effectiveness model, and it's got a single payoff in there for cost, and then also the appropriate payoffs for effectiveness as well. So let's just have a look at that in the model. So if we'll show you the model itself. It's a model that we tend to use a lot. So we have a decision node with a standard of care and new treatment as the strategies. And each of those is a Markov model here, local council, metastases, and dead being the health states. And if I select just the Markov node and we look at the Markov info down here and go to the health states, you can see that it's got kind of two active payoffs, one for cost and one for effectiveness. And the values are captured as we go through the model. The existing payoffs are currently a total cost payoff for the model, and they're broken down into kind of chemotherapy and medicine costs and also a hospital cost. But the output that you get from the payoff, is specifically related to kind of the total costs. So what we're going to do is we're going to look at splitting that. So I want to split the total cost into two new payoffs, a chemo medicine cost and also a hospital cost as well. So I go to the tree preferences and then I select build model outputs. Okay. And when I select that, this is what is going to give me the ability to be able to create new payoffs in the model. And prior to having this tool within TreeAge, you'd have to go through your Markov model node by node to do this. So hopefully this will show you a quick way to be able to do that. So what I'm going to do is I've got my two existing payoffs, cost and effectiveness, but I actually need my two new payoffs of chemo and medicine costs and also hospital costs. So I need to go down here first to the payoff preferences, and that will take me to the appropriate place in the tree preferences. And I want to calculate extra payoffs, and I actually want to calculate up to 4 payoffs now. So I need to go and create the number of payoffs first of all that I want to create, which is going to be 4, and then go down to custom names, and within here I can edit those. So the first one will still be cost, the second one will still be effectiveness, and then the next one I'm going to have is going to be chemo / meds costs, and then the last one is going to be hospital cost. Okay, so that's now created your 4 payoffs that you need. And the other thing that I want to do so that we can kind of see those being accumulated in our Markov model is I'm just going to go down to in tree preferences. If you go down to here where it says display and variables Markov info, and I can actually select to show that information for all active payoffs within the model. So I'm just going to hit apply and close there. So now I've created those 2 additional payoffs, and I'm going to be able to visually see them in my model, which is good. And then that takes me back to the kind of the build model outputs. So now what this build model outputs tool is going to allow me to do is what I want to do right now is I want to copy existing payoffs into new payoffs. So then I look at the options here. So what I want to do is copy my existing total cost payoff. So that's payoff 1. And I want to split it into 2 new payoffs. And it's already kind of populated them for me as I've created them. So it's splitting that into payoff number 3 and payoff number 4. If I had additional payoffs, I'd change the value here, and I'd also select appropriate the payoffs to transfer them to. And the tool will basically walk you through the Markov model. So here, this is where I edit and copy the existing payoff entries into new ones. So the first place I'm at is at local cancer, and I've got a cost here, which is totally a chemo medicine cost. And I want to copy that into my new payoff number 3, which is also the chemo medicine costs. So I'm not removing it from the total cost, but I'm just copying it and creating additional payoffs for me to monitor. So I'm going to click copy, and it will copy that value in there. And then I hit next. And then it's still at local counts, but now incremental. And again, that value there, medicine costs, I want to put that into payoff 3. And then again, go to next. And then I'm still at the local cancer node and the final reward. And again, this is a medicine cost. So again, I also want to copy that to payoff 3. Now when I go to next, it takes me to the node number 13, which is the hospitalized node. And here I've got this cost for hospital. So it wasn't payoff 3 that was going to capture my hospital cost. It was actually payoff number 4, the hospital cost. So I want to copy that into payoff number 4 and click next. And that's a transition cost. So it only has kind of 1 value to copy over. And then finally, it's going to take me to node 6, which is my metastases node. And here, again, we've got costs associated with medicine. So again, I want to copy those to payoff 3, click next and next. And then that's it. I've gone through all of the nodes in the model where I've got existing payoff number 1 to copy. I've copied them all across. And now that I've done that, all I need to do is click generate. And when I generate the value, you will be able to see now, because of the tree preferences that we set, where we're also capturing those additional payoffs within the model. So here you should be able to see I've got a 3rd payoff here for chemo meds cost. And over here at the hospitalization node, I've got the hospital cost being accumulated there as well. So the other thing that I can do to kind of show you how that's being captured and how it's split those payoffs in your model is if you just elect to go to analysis and generate the rankings report, you've got your usual outputs that you see here. So I've got my costs and effectiveness outputs for my standard of care and new treatment. But over here on the right-hand side, I've got my additional payoffs of the chemo costs and the hospital costs. And just as a validation, you should be able to see that if I add the hospital to the chemo cost, I get the total cost as I go. Okay, so same across for the new treatment as well. So just kind of validates how we've split that payoff and that we haven't lost any costs in the process. Okay, so this model here that I've just created and gone through with the payoff split is actually also in your help file. So there's a budget impact Markov before payoff split, which is what I just did. And then if you open this budget impact Markov after payoff split, you'll get the kind of split version that I've just done. So you can use that to validate any work you choose to do yourself. So now I've got those 3 separate payoffs in Excel. Costs, I want to look at exporting those to Excel, and then they could be referenced in a budget impact analysis model. So I'm just going to open the kind of the sort of final model, which is actually the same, which is just called budget impact Markov. Again, in your help file, in your TreeAge software, so that you can see that. And it should look like what we've just done here with the values split out. So in the example that I'm actually going to show you at the end of the budget impact analysis model, we're actually only going to be worried about the total cost. But when you build a budget impact analysis model, you may have additional cost payoffs that you want to export and also use in there. So I'm going to show you exporting all the three costs that we have in this particular model and sort of how that works. So using the model that you've got set up with your appropriate payoffs, in this case, this budget impact Markov model, the way that we use the budget impact exporter is we go to the views menu and we select this budget impact view up here. Okay, and that should open just down here with all your other views at the bottom. And so I'm just going to sort of walk you through what's in there and what you see. So we've got three tabs on this budget impact view. The first tab is for payoffs, and this is for selecting which of your payoffs you want to look at exporting. So in our case, we're going to select the total cost. We'll put that in there. We're going to select payoff 3, the chemo meds cost, and then also payoff 4, the hospital costs. And you'll see in here, those payoffs are all listed and they have a heading which you can edit if you choose to. So that will be then what you'll see in the Excel file where you export the values to. And you can also, TreeAge will give the cell that you send the value to in Excel a name so that you can reference it. But if you have a specific name you want to give it, you can kind of write that in here. We won't do that. We'll just follow along each of the values as we go through. You notice at the bottom here, you get this little red text as you usually do with TreeAge if there's something that you haven't done, which you need to do. So that's something that we haven't done is then say, well, of these payoffs, when do I want to capture them being exported? So if I click on the time period, this is then going to say to me, okay, what time periods do I want to capture these specific payoffs to then use those in my budget impact analysis model? Okay, so in this particular model, I want to capture the annual values of those payoffs, and I want to capture it over the first 5 years. So that's quite easy to do in this tool. So your annual cycle length is selected here. And the first year in the period is period 1, and then I want to do it over 5 years. So just click that up to 5. And then what I'll do is I'll click create by template. And this is the easiest way to do it. It'll just pre-populate everything you need. So it will say, okay, so the first stage starts at 1, 0 ends at 0, and the export header will be year 1 because I've told it was an annual cycle length. So year 1's an appropriate name for that. And then it will go down. So underscore stages 1 to 1 will be year 2, all the way down to the 5th year, which is, as you know, underscore stage is 4, because TreeAge starts at underscore stage is 0 as the first cycle within your model. All right. If you wanted to create your own sort of time periods, you know, every 3 years or something like that, you could use this create custom period, and all that does is pop an extra row in there and gives you then the option to edit what the first and last stages are and what the export heading is. And if you don't want that row, you just click delete period and it will remove that row out for you. Okay, so that's kind of the way to, again, create the time periods that you're going to capture your specific payoffs over. Again, this cell export name here is what will be given when you sort of export it into TreeAge, export it into Excel rather. So lastly, we go to the results tab, nothing there yet, but now we've got the payoffs on time period set. We can just click run analysis. And all that will do now is it will run the model depending on what type of model it is. So in our case, we've got our cohort model, but you could also do this for a microsimulation model too. So as is a cohort model, so all we do is select OK. Obviously, if it's a microsimulation, you need to tell it how many trials you're looking at there. And then the results are going to populate here. So if I just expand that a little bit out, it'll show you for then each strategy you've got. So we've got a standard of care and a new treatment. We had 3 payoffs, the total costs, the chemo costs, and then the hospitalisation costs, and how they're split over each of the years going forward in your cost effectiveness model. Okay, so data that you could have seen from your Markov cohort report, but it wouldn't have been split out like this, and it also wouldn't have been then easily exportable into Excel. I guess just a point to note would be that when these years are generated, you just need to be aware of if you have any half cycle correction or similar within TreeAge. If you do, it's going to sort of half cycle. It runs the model for each of these separately. So it does year 1, it just does that as a 1 iteration of the model. If it's doing year 2, it goes back and does year 1 and then year 2 and applies half cycle correction to that whole section. So you're going to have these slightly different values than you would from a Markov cohort report, just due to the half cycle correction. But if you have any further questions about that, you can just ask me when you generate it. Okay, so now you've got your values here. They look like the type of values that we need to use in our budget impact model that we've created. So all we then do is just click export to Excel. And what should happen is that you should get a Excel file that opens. And in the Excel file, you'll have 3 tabs in our case, because we have got 2 strategies, the standard of care and the new treatment. And on each of those tabs will be the payoffs that we've exported. So column B is cost, C is chemo meds, D is hospital costs, and then over the time periods we've exported them. So in our case, it was year 1, 2, 3, 4, and 5. And each of the cells in here will be a named cell. So this is for payoff 1 for year 1 for strategy 1. So this one here is for strategy 1 for payoff 3 for year 1, etc. as you go through. So you can now reference these named cells in any budget impact analysis model you make in Excel. So the same for the new treatment. And then you've also got a list of what all of the variables are at the time you exported these values from your cost effectiveness model. Okay, so that's kind of the Excel document that's exported. We think that format's fairly easy to use and fairly standard. But what I want to show you now is actually kind of incorporating this into a budget impact analysis model itself, and just how you would reference those values. So within TreeAge itself, if you go to your files again, where I showed you in healthcare, all of those budget impact models here, you'll see below them, it's got budget impact model.xlsx, which is the Excel model that I'm just opening now, which is in here. Okay, so I guess the reason that we wanted to show you this was just to show you how easily it is to incorporate, first of all, these values into any kind of budget impact analysis model, and then sort of how we reference them, and just a couple of considerations to take. We know that there are many different budget impact analysis models out there, and for TreeAge to actually generate that for you, it would be one for one person per person, like they'd be different for everybody. So I guess the closest we've got is being able to export the values that you need in your budget impact model, and then you can incorporate those where appropriate. So you can see, like in the model that we've got sort of 4 tabs here. The first one is your budget impact model itself, and then the next 3 are the values that you've got specifically from TreeAge. And I just want to sort of talk you through, I suppose, what I've got in here in my budget impact calculations. I guess some of the challenges that we had creating this. So basically, I think the main things to consider are your kind of years as you go through your budget impact analysis model. So we've got a number of patients that we've been given that progress through the model, taking the standard of care at the moment. And I guess one of the important considerations is how these patients cascade through your model. So the group that are here in 2021 having the standard of care treatment will be on year 2 of the treatment in 2022. So that kind of group sort of progresses down through your model here. But what happens is there's also a new group populating your model, and they're going to go into your first year every additional year within your model. So here in 2022, you've got a new group of patients going in, as well as your existing group who are now in year 2. So that kind of how this flows through your model. And again, as you go through, you can see the cascade there. So obviously over time, the total population expected to receive treatment is going to increase as more people are added each year. On top of having kind of the population that's having the treatment changing, you've also got whatever dynamics are going to be in place in regards to the uptake of your new treatment. So currently it's quite easy because everyone would receive the standard of care, but as soon as you implement a new treatment, how do people progress onto those treatments? So in our particular model, we have like a uptake of new treatment, which has been designated by somebody that's not necessarily us, sort of saying how, as years go on, the new treatment will be uptaken. And then all we do is say, well, of those patients who are in year 1 in 2021, 20% of those will get the new treatment. So we just multiply the population in year 1 out appropriately. And then as you go down, so now people in year 2, what proportion will they have? Well, they're going to now be adjusted based on the year 2 population, but you've also got the existing people who are still cascading down as you go. So it's just ensuring that you're using the appropriate uptake in the appropriate year as the patients pass forward. Okay, so again, the values that you've got here should, in this last column G, should sum up to the total population that you've got. It's just that some will be on standard of care and some will be receiving new treatment as you go. So when you've got the patient population, the population sorted out into which will be receiving treatment, you can then incorporate your cost for treatment. And these values here come directly from the values that you've exported from your cost effectiveness model. So you've got a standard of year cost for year 1, year 2, year 3, year 4, and year 5 coming from your cost effectiveness model, and the same for the new treatment. And then finally, it's compounding those together to compare what our current budget impact would be if we remain on standard of care only, compared to the new budget impact, which would be a gradual uptake of the new treatment. Okay, so then all we have in our really simple model is say, well, we know that we've got a certain amount of population who are receiving the standard of care treatment in year 1. So we multiply that population by the standard of care cost, and it gives you the total number for the population. And you kind of go through working out sort of what those values are, ensuring you're multiplying the right year of cost by the right amount of population for that as well. So we've kind of split ours up into those receiving standard of care and new. It's easier to look at, but ultimately what you end up with is you end up with totals here for if you remain on the standard of care with the population progressing through as it is, and then totals down here which say, well, this is the the new scenario that you've suggested in terms of the uptake of new treatment, and this is the cost that will give us. And then you look at the net impact of that. So what is the budget impact analysis? So basically taking your new versus your standard of care away, and you can see the net impact of that as you go. So that's kind of just us demonstrating to you how these values are incorporated into a very simple budget impact analysis model. Something that's really, I guess, important to note is that if you happen to change stuff in your TreeAge model, some values change in there, it's really simple for you as a TreeAge modeler to then just go back to this budget impact, rerun this export here and export it to Excel. And then all you would need to do in this kind of model is just overlay those values on the top here, okay? So it's a really quick way for you to update those values going into your budget impact analysis model. So, yes, that's kind of how you get those values out of TreeAge cost effectiveness models and incorporate them into a budget impact model. We know that there's many different budget impact models out there, but we're hoping that this kind of tool will allow you to export the data you need in a format you need to incorporate it into those models. Okay, so I don't have any further information to add at the moment. If